Hi, my name is Patricia Luz, and I am going to talk about cholesterol embolization after transcatheter aortic valve replacement. Definition: cholesterol embolism syndrome should be suspected in a patient with developed worsening renal function, hypertension, distal ischemia, or acute multisystem dysfunction after an invasive arterial procedure. Arterioemboli may also occur spontaneously. Cholesterol embolism is a disease of persons ranging from middle age to elderly, with a minimum age of 15 years.
Embolism.
Embolism is occlusion or obstruction of vessel by an embolus.
What is an embolus?
An embolus is a detached intravascular solid, liquid, or gaseous mass carried by the blood to a site distant from its origin.
Type of emboli.
Application in medicine: transcatheter aortic valve replacement is a minimal invasive procedure that replaces a narrowed aortic valve that cannot open properly. In this procedure, doctors insert a catheter into your legs or chest and guide into your heart. Pros and cons. Pros: detecting this pathology in time will allow the correct medical intervention, reduce death in Italy were some hidden complicated right association. Cons: not detecting this pathology in time can cause end organ damage, be mechanical bleeding, and inflammatory recurrence. The initial cost of the procedure is high. Many answers need to be addressed before option in a low risk patient.
The pros and cons of transcatheter aortic valve implantation. These are my disclosures. The PARTNER trial was the first clinical trial to demonstrate the efficacy of TAVR in both inoperable and high-risk populations. TAVR was associated with a significant decrease in overall mortality at 5 years compared to medical therapy, although survivors in this high-risk population was limited due to medical comorbidity and high-risk.
Ensure application in Ecuador. Aortic stenosis is one of the common cardiac degenerative valvular disease, with a prevalence of 1.3% in patients between 65 years and 74 years and 2.8% and 4.6% in patients greater than 75 years of age.
Good morning. Thank you for joining us for this UCLA Health webinar. I'm Dr. William Suh, and I'm an assistant clinical professor in the Department of Medicine, and I'm an interventional cardiologist here at UCLA. Today, I'm going to talk to you about a new procedure called transcatheter aortic valve replacement. It's a new way to actually treat aortic stenosis. Just wanted to add here that you can ask questions on Twitter using hashtag UCLAMDchat. So this is an example of a coronary angiogram, and right here in the middle of the left anterior descending artery, there is a stenosis, a blockage, and this
Conclusion: the prevalence of IAS continued to rise over time among our aging population. With advance in the field of interventional cardiology has already become a treatment option for several stenosis in the inoperability of high-risk surgical candidates. In addition, the use of trans-valve reliefs for the treatment of the pathology of lower-risk patients in venous blood.
It's very important to recognize heart disease because it's the leading cause of death in both men and women.
The goal of Rush's Structural Heart Disease Center is to treat patients who have valvular heart disease as well as structural heart disease.
Thank you.